So I'm going to be recording my central line dressing kit change skill. So here's my workspace. So I got my sterile gloves because the ones in here don't fit me. My dressing kit, tape measure, tape, and then clean gloves. Nothing else on the table. Nothing on the patient's bed except for my patient here. Nothing up here and nothing over there. So the first, let me make sure that we're angled here good.
Okay, but I might just do it to get it done.
Alrighty, so the first thing we're gonna do is we're gonna check our order. See that his dressing is a couple days old. We're gonna change it. We're gonna check for allergies with isopropyl alcohol or CHG. Gather our supplies, which I just showed on the camera. Wash our hands, introduce ourselves, and identify the patient. So, hi there, my name is Zach. I'm going to be your nurse today, and we're going to change your dressing. Could I just get your name and date of birth? He goes, Ray Romano, 12/22/56. I look at his name band. It checks out. I ask, so then I'll provide for privacy, explain the procedure, tell him that we're going to take it off, put a new one on, and I say, is that okay with you? He says, that's okay. So now I'm going to open up my dressing kit, put down my barrier or sterile field. Okay. Then I'm going to wash my hands, put on a mask. I already have one on. Put Ray's mask on. If Ray can't tolerate the mask, I'll just have him turn his head away from the PICC line. And then, so now that that's on, his mask is on and my mask is on, I'm going to wash my hands again. Put on clean gloves. And I'm going to inspect the site, or well, I'm gonna measure it first actually. So I'm going to measure the circumference of his arm 6 inches above the insertion site. So, and I'm gonna measure that. Don't let your mask fall off there, Ray. Okay, 24.5. And then I'm gonna measure the length of the PICC line from the insertion site. Okay, and then we're going to compare this to his baseline, making sure that it's not farther in or farther out. Okay, now I'm going to look at his skin and the surrounding area, checking if there's any redness, if it's hot, if it's tender, any pain that he's experiencing, if it's infiltrating, anything that's just abnormal. And then now I'm going to take the dressing off carefully, having my hand here as a weight, and I'm going to, if I can get it off, I'm going to pull it towards the site. And okay, and then once I have the tegaderm off, I'm gonna address it for any discharge, so the color, consistency, the odor, and the amount. And then I'm gonna be looking at the PICC line itself. So looking at the hub, making sure the line's intact, make sure there's no extra holes. Then I'm going to remove my gloves, wash my hands, don sterile gloves. Let me move my computer back. So I'm going to don my sterile gloves. just gonna. These wouldn't be in the bag, obviously, so I forgot to take them out. And so now I'm going to grab my forceps and my alcohol, and what we're gonna do is here. Sorry, you can't really see the line there. Obviously, I would keep my hands still sterile, and I'm going to pick this up, pick it up, and go around the site in a circular motion. Once that's clean, I'm going to throw it away. Grab my CHG. I would crack it open and then do a window. Oh, well, if his mask would fall, you can't really see it, but his mask just fell off. But I would, if he couldn't tolerate it, I would, like I said, I would make him turn to the other way. Throw this away once it's done, and then I would grab my skin prep and do it in a window motion again. Okay. Throw this away. Next, I would grab my Tegaderm and I would put on my Tegaderm. I probably would have already had this open, but put it on, making sure that it's not obstructing the hub. And then taking off the film. And then is this tape? Wow. Usually these, I think this is tape. Oh yeah, it is. I just can't get it off. Okay, I would then tape it, and then I would initial it and date and time of when I changed the dressing. Take off my sterile gloves. Take off my sterile gloves, wash my hands, take off my mask, and as I move it up now, take my mask off, and take off Ray's mask. It's off right now because it fell off, but I obviously would remove it right now. Wash my hands again, clean up my area, make sure that Ray is comfortable, ask him if he needs anything. Then I would leave the room, wash my hands again, and then document that any of the drainage, the skin around, as well as if the catheter was intact, and then the time and date of when I changed the dressing. Lifestyle considerations, obviously, we could have some impaired skin integrity with more elders. Allergies could be another. What else could be elderly consideration? People on blood thinners could be more prone to bruising, so we could see more bruising, or if they have more fragile skin, it could be harder to, or more painful to rip off the dressing. So yeah, that's my skill.